Today I want to discuss one of the scariest things in the whole world, my boss. I'm only kidding. He is a dentist though, and to many people that is the scariest person in the world. Seriously though, I want to talk about dentistry. I want to go over tooth decay, gum disease, and overall dental hygiene. I feel it's appropriate to talk about dentistry right about Halloween too, because the dentist is a little scary. There's an extremely large amount of adults and children who cannot bring themselves to take care of their teeth out of pure terror. In our day and age where beauty is everywhere, our smile is our best accessory. If you're not proud of your teeth, it can come off a little unwelcoming. Tooth decay begins innocently enough. A lack of minerals that leads to the enamel wearing a bit thin in certain areas, and over time it progresses into something a little bit more sinister. It is relatively easy to get cavities and tooth decay. All you need to do is eat and drink lots of food that are high in acidity and not brush your teeth as often as you should. Decay begins with a demineralization on the toughest surface of the tooth, and that is the enamel. Upon decalcification of the enamel, the tooth is often at risk for decay to set up shop. Once you have worn the enamel down in various different ways, it becomes weaker and more prone to decay on the softer material underneath. The softer material I'm referring to is the dentin. The dentin is 10 times less crystallized than the enamel, so it kind of makes it more risk for decay. According to James Nicholson of Operative Dentistry, if the decay continues to advance past the dentin, it will then proceed into the nerve chamber of the tooth, and that is when the pain will begin. Once decay is into the nerve of the root, a root canal is inevitable. Of course, with proper treatment, most decay situations are fixable with dental restorations and just being on top of your bad habits. This is supported by Richard Matheson, 1995. The enamel and the dentin are both very tough, but they do not regenerate. Once you lose them, you lose them. Decay is not the only thing frightening that can happen to your mouth. Gum disease plays a major role in the loss of adult dentition. If a person forgets to floss regularly, and maybe as a smoker, they are at high risk for inflamed gingiva, which leads to infection around the teeth and eventually bone loss. According to Caprinza's Clinical Periodontology of 2002, once the inflammation of the gums has occurred, due to the plaque buildup, the gums begin to recede and increase the chance of a bacterial infection. Once the gum disease has begun, there is really no cure. The best way to approach gum disease is to stay in a constant therapeutic cleaning schedule and keep your gums in a gingivitis remission of sorts. Once a patient gets on a regular cleaning schedule, there can be little to no scary events at the dentist. Don't get me wrong though, going to the dentist doesn't have to be scary all the time. A great rule of thumb to avoid being in the torture chamber, the dental office, is to brush daily and floss often. It takes time to create the habit of great oral hygiene, but like anything else, if you do it enough, it will become second nature. A great way to begin doing such is to brush early in the morning with a fluoride toothpaste to help remineralize the enamel and maintain a strong surface against cavities. And adhering with William Cohn in the CDC 2001, the recommendations for dental use of fluoride to achieve maximum protection against dental caries, efficiently in reducing the likelihood of enamel fluorosis. Another great tool to help avoid these dangerous situations is flossing. Flossing is extremely important in the fight against gum disease and decay. According to Jerry Nicholson, a demineralization that leads to caries is avoidable with proper home care. Overall, brushing and flossing can ward off any of the scary dentist monsters. To achieve better dental hygiene, I think it's great to understand what you're up against. Proper brushing and flossing to avoid plaque buildup on your teeth and keeping a schedule of your oral hygiene habits will prevent decay and gum disease. To avoid being my boss's next victim, make sure to prevent cavities and take care of the gums you're given, because unfortunately they're the only ones you get. Yay!